Thank you very much. Good morning, everybody. Nice full house today. Firstly, I'd like to express my thanks to Digital Jersey for putting the event together. Tony, Chris, and Courtney and the team. It's a great event, great week of activity going on. There was a great day yesterday with the IoT. There's a few more events going on this week, which I'm sure some of you will be getting along to. So today what I'm going to talk about is really tech, digital health, what are the benefits, and some of the export that we've done off island. When I was preparing for the speech, it got me thinking actually about Jersey Tech Week. What does tech mean? It's a big broad brush that everybody talks about, but actually what does it really mean? So thought we'd explore that a bit further. Just to position us a little bit so that for those who don't know who we are, TSG, we're a local technical services consultancy business that provides services across software development, change management, tech solutions, and BI. As an organization, as a group, there are effectively 3 companies that provide different components. We've got the resource, the consultancy business, TSG, which is based in Jersey. And then we've got 2 other businesses, TBS and TAS. TBS is our medical billing platform. That's a platform that we've built locally over the last 10 years. It's deployed across the Channel Islands, Jersey, Guernsey, and Alderney, across all GPs, all practices. And then we've got 1% coverage across the NHS in the UK. So it's a great story of export, and our Executive Director, Danny Bannister, who's coming up shortly, he'll give a bit more about the journey of that and how we've been able to grow that through our own in-house development teams and then take that off island. So some of the other areas that we've done, something that's key for us is partnerships. So, we can only do so much. So we work with other partners to help enhance and enrich the services we do. So clearly working with, in the healthcare space, the likes of EMIS, Microtest, NHS Digital, enables us to be able to reach out and provide services in different areas. And across other areas of the business where whilst we focus on healthcare within our business, we also focus within financial services, retail and banking. And so we have partnerships which support those relations as well. We've developed 5 commercial products. One that I've mentioned, the medical billing. The other ones that we've developed are financial services products, an auditing platform which uses AI and algorithms to go and recover VAT and duplicate payments across accounts payable system. And then we've also developed products which support document management and record management solutions. Our medical billing platform has over 1,300 users across those different locations, and that number's growing as we speak. So, getting back to tech. What is tech? So technology, big broad brush. A definition that's that I found on the internet is quite convoluted and quite long. So, but essentially what it is to make something, to either make our lives easier or to solve a problem. So I just want to take a moment to talk about some of the tech or technology that's been brought into society over the last 150 years. When we look back and think about the telephone, the telephone 150 years ago, a very simplistic device that we look at now, but back then it was obviously advanced technology. But we look at technology today with a phone, and it's moved far away from what it principally was. It's a smartphone. We probably use our phones for more other things than actually making phone calls on it. Look at air travel. So going back, turn of the century, the Wright brothers had the first flight. This flight had one person on it, it lasted 57 seconds. Move on to today, we've got the most advanced airline, a twin-engined, wide-body aircraft carrying 400 people that's now just set a world record for the longest flight of 19 hours. The tech that's involved in this aircraft is incredible. And again, similar stories with the car. So the turn of the century, the Model T Ford Boss, it wasn't the first car. The first car actually came 30 years earlier. The thing with this car was that obviously it was the first mass-produced car. And then we move on to today, and we think about the Tesla. So Elon Musk is going to market with the same principle of producing a mass-produced electric car. Also with this car, though, it takes it a step further, and it takes it that actually, out the box, these cars are fully capable of being autonomous. They've got multiple sensors, as you can see in the diagram at the back here, that scan the world and look around and work out where objects are. And these autonomous cars have been in practice now for 10 years. It's probably a few years before they're actually truly accepted on the road, but actually it's the way that we're moving. The first television set, you can see we're coming a bit more closer to home now with regards to the dates, but we look at the first television set, 1930s, again, very simplistic, but really advanced at the time. Compared to a television set now, this is the latest television that LG have produced. It's over 2 meters wide, and it's as thin as a leaf. Now this one's quite interesting, because on the left we have the Viking 4, which in 1950 was the first rocket to go into space. The interesting part was actually that globally, the world only recognized where space was in 1947. They knew literally where it was, but they never defined the barrier between what was the Earth atmosphere and space. So from 1950, they managed to put that in. It took another 11 years before the first man went into space in 1961, and until 1969 to get the first man on the moon. We advanced forward a fair number of years to today, where the space industry has been predominantly, one company, NASA. But now we very rarely hear about NASA. We know they still exist and they still do stuff, but actually it's all about SpaceX. And what they've managed to do is obviously try and again bring about commercial space travel. And over the last couple of years, what they've managed to do is to take this rocket, shoot it up into space, but then the components that have got it into space, they can actually land them back on Earth and reuse them. So the cost and the efficiency and the productivity is far greater than it was where they used to just shoot something into the sky. And also just talking about the first microprocessor. So in 1971 was when the first microprocessor happened. Very technically advanced at the outset, but actually, we look back on it nowadays and think it can barely do anything. But today, the latest chipset that's come out from Apple is literally millions of times faster, a million times more capable. And it's the size of a thumbnail. It's 1 centimeter, and it's wafer thin. Incredible advancements of technology. How does technology fit into the current generation, and why is it important to understand what technology is about? Well, these are just some examples of the current generation who are adopting technology. And we look at top left. When you've got young children and they're late at night and they're screaming and they're crying, and the only way to get them to sleep is to stick them in the car and drive around the block. But nowadays they can simulate that by putting it into a device that actually simulates the car journey. The younger generation who are growing up now, they're used to speaking into devices and talking to Alexa or Cortana or Siri to order things online or to understand what the weather is. Autonomous vehicles. The airports are adopting autonomous vehicles to take people from the car park to the departure and arrivals terminals. In fact, at Gatwick, when you go between North and South Terminal, you get on a monorail. There's no one driving the monorail. It's an autonomous vehicle. Okay, it's on a track, but actually you don't get on and question there's no driver. And a lot of the trains in the underground are actually now driverless. Some have drivers still there just to, do an emergency brake if they have to. but actually a lot of them drive themselves. Also, just the behaviours around check-in at airports. So now we go into an airport, and actually a lot of us don't think about the fact that you just walk up to a device, put your booking reference in and check yourself in. But if someone had said that to you 10 years ago, that you didn't interact with someone to check in, you'd find that quite strange. And then we look at some of the other technologies, younger generation being brought up on virtual reality or augmented reality. They can travel to places. Before they go there, they can have experiences. And then we've got in healthcare things like telepresence and robotics that are services that are now becoming mainstream. But again, it's the mentality that 10, 20 years ago, we wouldn't have accepted these in society, whereas now the generations are going, well, you know, of course it makes sense. Why wouldn't we? A bit like my daughter, she's been brought up with an iPad. And when I get my laptop out and do some work on it, she doesn't understand why you can't touch the screen and move the screen around. Because to her, it's natural, you would do that. The idea of a mouse, it's alien. Just use your finger and move the screen. And then obviously we've got the aging population that come from a generation where tech isn't so prevalent to them. And so there's, you know, an area of challenge there, being able to bring them into modern society. So why is it important to understand this from a healthcare perspective? Well, the reason is because of behaviours. So just talking of the aging population there, understanding that, you know, a large majority of the aging population who come into hospitals, that, you know, tech won't just naturally come to them. So if we introduce tech into that environment, then actually, you know, we want to make sure that it's something that they can adopt. And our behaviours, just with the whole adoption of technology, we spoke about mobile apps before, and being able to, you know, interact with your phone, and we're working on an assumption that actually everyone has a smartphone and that we can use those technologies. Clearly, healthcare is a sensitive area, so we have to be mindful of that when we're delivering solutions into that space. We're talking about sensitive data, and there's a whole vast array of elements around governance that we need to make sure we're mindful of. And then engagement, being able to engage with people in a way that they, you know, are interested in, and, you know, those are things like, you know, gamification is a great way to be able to get people engaged so that they can, you know, go on a digital journey that they don't feel like they're just interacting with something, that there's some gamification behind it. But moving then into digital health, again, it's a bit like tech. It's a bit of a broad brush. What does it really mean? There's no one, it means this, it's one thing. But essentially what it is clearly digital sits at the heart of it. And what we're doing with digital is we're interlacing that into, you know, into healthcare. It's the convergence of digital and, you know, traditional healthcare. Lots of different components to that, and I'll just kind of pick out a few that are probably most relevant. So things like connected health, that sits at the heart of it, really. The two components here, connected health and interoperability. You get those two bits set, then the rest can put on top. Without those, then it's a real challenge. If you can't get systems talking to each other, then you can't enrich the data, you can't bring up that joined up approach. The digital pathways, which, you know, the states of Jersey are working very hard at the moment to bring together that digital pathway between primary and secondary care. It is a fundamental foundation to all the other services that we can then layer on top of that to deliver different services across the health ecosystem. Along with that, in digital health, things like data analytics, being able to get data, understand data, being able to use that data through visualizations and dashboards, and then take that and use insights and have meaningful insights to make decisions. Patient portal, being able to give access to your personal record, whether that's a full record or a summary care record, but actually, you know, whose data is it? Do we have access to it? How can I get one picture of all of my data? And another key area is around digital records. You know, traditionally, healthcare has been a very paper-based system. You know, we walk into a number of practices, and there's boxes everywhere, and there's paper everywhere, and, when you go in the hospital, it's a paper file that gets pulled out to go and add your record to it. Times have changed where a lot of that can be digitalized. But not just digitalized, we need to have the means and the techniques to be able to deliver those digitalized records to the people who need them at the right time. And then we've got emerging technologies. So I mentioned it before, things like VR, virtual reality, augmented reality, artificial intelligence, machine learning, and then gamification. Virtual reality is obviously a very interesting topic, especially within healthcare, because it's a great tool to be able to provide education, as with augmented reality. There's some very clever stuff going on in that space. There's, examples at the moment where they're looking at pain relief through the use of virtual reality. So there's lots of areas that can be enhanced and used in that space. Okay, so I've talked a bit about tech, talked a bit about digital health, and whether it's tech, whether we're developing new tech. So even when we look at the examples of tech that we had, sending someone to the space or sending someone to the moon is incredibly challenging, complex, difficult. Many elements, many stakeholders, has significant cost. In many cases, you're going into uncharted territory. You've not been there before, so, and a lot of people haven't been there before. And then obviously there's risks, and you've got potential skills gaps. So these are the challenges, not just in the tech world, but in healthcare as well. The same principles apply. A lot of what we're talking about in, the digital health world is actually trying to find, well, if someone else has done it, we can follow their model. But actually, a lot of these areas are still uncharted territory, and people are still trying to find the right way. So clearly, though, what we can do is plan for success. When they invented the first plane, they didn't envisage that the plane would be what it is now 100 years later. They envisaged what they needed at the time, and then iteratively we've got to where we are today. So whilst it's good to have a strategy and a vision to what the end goal will be, the reality is you want to break that into bite-sized chunks and deliver small components along the way in an agile way so that we can measure success much more quickly instead of just waiting years to get somewhere that may or may not actually deliver what you need it to deliver. Key leadership is a key element. So, the captain of a ship, you need a captain of the ship. Without the captain, the boat wouldn't know where to go, even though there's a team behind him. The pilot is a very important person on the plane. He may not be flying the plane. It may be the first is other person in the aircraft. But actually, you still need a captain. You need somebody who's a key leader to drive change. And making sure we understand what our requirements are up front. What are we trying to do? What are we trying to deliver? How can we deliver that? And make sure we've got appropriate funding for it. One of the areas of this is quite difficult is that we go into big projects, big change, and actually don't necessarily map out really what we need. We're kind of driven by what the budget is instead of saying, actually, if we really want to deliver this, this is how much it's going to cost and this is what it's going to be. But more importantly is working together. It's not a siloed approach. It's for us as a business as well, it's all about partnerships. Working with different agencies, different departments, different people, and collaborating together and being able to come to a success. Okay, so some key principles. If you are going to fail, then fail fast. Get it over and done with. Yeah, don't wait 2 years, then fail. And don't be afraid of failure. If everything was perfect, then you wouldn't need change management in there. It was just everything would just happen. So, but also provide transparency and governance and responsibilities. Know what people are doing when they're doing it and what they need to do. Keep communicating. Don't go silent. But also the main thing is just drive for success. Get stuff done. Don't become stale. So whatever approach you've got, be innovative. Be thinking forward. How can we deliver? So have the right attitude. And find a way. That's a key element as well. I find that it's actually sometimes people find themselves delivering something or looking to plan something, and then they find themselves at a blocker and go, "I'll give up." But find a way. There's always a way. So as a business, for us, it's around the key components I spoke about before: software development. In our space, we understand healthcare, we understand the frameworks, we understand the protocols, we understand the people. We've been around it for 10, 15 years in various forms. So we're well placed to help with integrations and developing, widgets or whatever it might be. Technical solutions, being able to support that infrastructure, being able to support the servers and the components that sit behind it. Change management, obviously providing the oversight, the governance, the capabilities in that space, business analysis, project management. So we're ready and we're able to help in that space. Some examples of work that we've done, many books. People in the room might know that's our medical billing platform that sits in the Channel Islands. We work with the states of Jersey on a number of different projects. Clearly we're working with the NHS for the mesh, that's the interconnectivity between the spine and Jersey. We understand HL7 technology. Egton Billing is our UK version of the medical billing platform. And then we've got a relationship with Intersys and producing Zen reporting, ensemble and cache capabilities. Okay, so finally, and then I'll hand over to Danny. So I just want to take a moment just to talk about the journey over the last couple of years. So one of the areas that's been a challenge for suppliers is engagement into the industry. And instead of just working individually, trying to knock on the door to try and find a way in, that way didn't work. So collaborative working what was key. So a few members got together and thought there's a better way to do this. So let's try and work together, let's work out our strengths, and let's talk to industry as a group. So medtech.je was formed back in 2015, and essentially what it was to do was to bring that group together, be able to talk to industry and demonstrate capability. And we've got some very clever people on island, not just in our business, but in all the other supplier businesses on the island, tech businesses, who are very capable of delivering. And so through medtech.je, we had engagement, which was great. So we had dialogue and we had engagement. The challenge was then to take it to the next level of actual, real collaborative working between, whether it be in primary care, secondary care, or, tertiary care or other care services. And this is where we needed to morph, and Digital Jersey suggested that it would be a really good position for them to be the independent party that sat between industry and the supplier. So through 2017 into present day, that transition happened, so now we have the HACT group, which obviously doesn't come up very well on there, but the HACT group, so that's the Health and Care Technology Group, which is independently managed and looked after by Digital Jersey. So that now comprises of a number of local tech businesses and suppliers who sit in that space, and we meet regularly to talk. Now, I'm not sure if many people in the room knew about this group, but this group is a very powerful group that can help you as stakeholders and businesses to go somewhere to talk to about technology. You may have an idea, you may have a project, you may have a desire to do something, but don't know where to go and talk. You don't know who to engage with. Well, come to Digital Jersey, come to the HACT group, and we can give you advice, independent advice around that, and be able to guide you in the right direction. Again, whether it's with our business, another business, it doesn't matter. The main thing is that actually it gives you an opportunity to talk to someone and engage with someone that understands your space. So I'd really recommend anybody who doesn't know about HACT, get in touch, come join us. We're welcoming other businesses in there, whether they're from industry or whether they're from suppliers, and that will enable us to be able to go and provide better solutions and deliver, better care all around. Okay, so that's me. Thank you very much. I'm going to hand over to our Executive Director, Danny Bannister. Danny's going to talk to you about exporting our digital health automation across the UK. Thank you.